Ancient Egypt tested pregnancy with grain, and sometimes it actually worked. No plastic stick, no laboratory, and definitely no 2-minute digital countdown. Instead, a woman watered bags of wheat and barley with urine, then waited for shoots. But that famous test is only one part of the answer. Most ancient women first relied on missed bleeding, changes in appetite or nausea, breast changes and fatigue, and the judgment of people who had seen pregnancy before. When those clues disagreed, certainty might not arrive until the baby moved. That could leave weeks or months in which a woman suspected the truth without being able to prove it to herself or anyone else. The story is therefore not a contest between clever modern people and foolish ancient ones. It is a story about making decisions from incomplete evidence with extremely personal consequences. To understand how they knew, we must separate suspicion from proof and history from viral folklore. The honest answer is uncomfortable. Early on, many women did not know. Pregnancy begins invisibly, and the hormone detected by modern tests cannot be seen, smelled, or felt. Today, a test strip detects HCG in urine. Ancient observers had no way to isolate that molecule. The placenta begins producing HCG after implantation, and even a modern test can be negative when it is taken too early or used incorrectly. Biology does not raise a tiny flag at the moment of conception. Ancient women faced the same invisible beginning, only without a chemical detector waiting in a bathroom cabinet. They had patterns instead: a cycle that failed to return, a body behaving unusually, and a sexual history that made pregnancy possible. Each clue changed the probability, but none created certainty. So knowing was a ladder. First suspicion, then growing confidence, and finally, physical evidence that was difficult to explain away. For someone with regular menstrual cycles, a missed period was the most useful early signal. Women did not need a modern calendar app to notice a rhythm their bodies had repeated for years. They could remember the last bleeding, connect it with seasons, festivals, work or household events, and notice when the expected return never came. We should not assume that every woman followed a perfect 28-day cycle or kept a neat written record. Human cycles vary, and practical tracking can be as simple as remembering that an expected event has passed. But a late period is not a pregnancy certificate. Breastfeeding can delay menstruation, and stress, illness, heavy physical work, or inadequate food can disrupt it. Cycles can also be irregular for reasons no ancient healer could identify. A missed period therefore mattered most when it appeared beside other changes. Alone, it was a clue. With a whole cluster of symptoms, it became a much stronger case. Then came the body's less subtle messages: nausea, vomiting, unusual tiredness, tender breasts, frequent urination, and sudden dislikes of familiar foods. Some women may have recognized the pattern quickly, especially after an earlier pregnancy. Others experienced only a few signs, or none that felt remarkable. Morning sickness can also happen at any hour because the body has never respected the label. Smells may become unpleasant, appetite may change, and emotions may feel different, but those experiences vary enormously. The awkward problem is that nearly every early symptom has another explanation. Bad food can cause nausea, hard work can cause exhaustion, and an approaching period can make breasts sore. Even today, symptoms alone cannot confirm a pregnancy. In an ancient household, the question was not whether one sign appeared, but whether several arrived together, persisted, and fit the timing. The human body was the test panel, which is convenient because it was always nearby, and inconvenient because it refused to include instructions. Experience made that uncertain panel easier to read. A woman who had been pregnant before could compare new sensations with memories of her earlier pregnancy. Mothers, relatives, neighbors, and midwives could recognize combinations that a first-time mother might miss. Their knowledge came from repeated observation: which changes appeared early, which faded, and which pregnancies later produced a healthy birth. A midwife could ask questions, compare the abdomen and breasts with familiar patterns, and keep watching as the weeks passed. She could improve the judgment process, but she could not manufacture certainty from signs that were still ambiguous. That practical knowledge rarely survives in the woman's own words. Most surviving medical texts were copied by literate specialists, often men, and they preserve only a narrow slice of everyday life. A written recipe proves that somebody recorded an idea. It does not prove every household used it. The largest ancient database was probably human memory, shared quietly across generations. The most famous written experiment comes from Egypt. A medical papyrus from around 1350 BCE instructs a woman to moisten wheat and barley with her urine over several days. Egypt already had a long written tradition concerning women's health, but this grain recipe stands out because its result could be observed outside the body. The instructions turned an invisible question into a small agricultural experiment. If the grain sprouted, the text treated that as evidence she would give birth. It also claimed barley predicted a boy and wheat predicted a girl. If neither grew, the verdict was no pregnancy. This was not merely someone staring wisely into a cup. It was a procedure with materials, repetition, a waiting period, and a visible result. In other words, ancient Egypt built a biological assay using two grocery items and absolutely no customer support number. Clever structure, questionable warranty. Here's the part that makes the story more interesting. Researchers tried the grain method in 1963. In that experiment, urine from pregnant women promoted growth in about 70% of cases, while samples from non-pregnant women and men did not. The method failed, however, to predict fetal sex reliably. That result is often flattened online into the test was 70% accurate, but that is too confident. Accuracy requires more than one attractive percentage. It depends on false positives, false negatives, sample size, procedure, and whether other researchers can reproduce the result. Seed quality, temperature, water, soil, and waiting time can all change germination without saying anything about a pregnancy. A growth rate in one old experiment is not the same as a validated clinical test with known sensitivity and specificity. Researchers have suggested that elevated estrogens or other features of pregnancy urine may have affected germination. The test was not detecting HCG in the precise way a modern strip does. So the fair conclusion is fascinating but limited. The idea may have contained a real biological signal, while still producing plenty of uncertainty. Greek medical writers also wanted an answer, although some of their methods were less botanically impressive. A Hippocratic text advised giving a woman a honey and water drink at bedtime. Pain or rumbling afterward was supposed to indicate pregnancy. There is no good biological reason to trust that result, unless the real diagnosis was drank too much honey water. The test still reveals something useful about ancient reasoning. Healers expected pregnancy to alter the body as a connected system, so a reaction in the abdomen seemed meaningful. The underlying theory was wrong, even though the desire to provoke a measurable response sounds surprisingly experimental. Other Greek writings judged pregnancy or fetal sex from the eyes, complexion, breast, or the direction of the nipples. These ideas mixed observation with theories about the female body that were simply wrong. And one popular internet mistake makes the confusion worse. Garlic smell tests are often called ancient pregnancy tests, but surviving Hippocratic examples usually concern fertility, whether a woman was thought able to conceive. Ancient medicine was strange enough. We do not need to give it extra homework. By the early 2nd century CE, the Greek physician Soranus wrote a detailed work on gynecology for the Roman world. He discussed signs associated with conception, including menstruation stopping, changes in the breasts, shivering or bodily changes after intercourse, and heaviness in the limbs. Some signs appeared immediately in his account, while others developed only as pregnancy continued, which shows how easily conception and pregnancy could blur together. An immediate sensation after intercourse might feel persuasive, but it cannot reliably show that implantation will occur days later. Some observations were useful, others rested on ancient physiology. What matters is the method behind the list. Soranus tried to combine several signs rather than trust one magical object. His work also shows that midwives were recognized practitioners with expected knowledge, judgment, and practical skill. Still, a physician's checklist did not replace the woman's own report. She knew whether bleeding had stopped, whether nausea kept returning, and whether her body felt unlike its usual self. For many pregnancies, the strongest confirmation arrived much later. The first felt movement of the fetus, known as quickening. Modern evidence places that first perception across a broad window, roughly 14 to 22 weeks, with many first pregnancies noticed around 18 to 20 weeks. At first, it can feel like fluttering, bubbling, or gentle tapping. Someone who has been pregnant before may recognize it earlier. A first-time mother might initially mistake it for digestion, then reconsider when the tapping returned with suspicious determination. There was still no view into the uterus, but the evidence was now repeated, internal, and increasingly difficult to dismiss. To an ancient woman, repeated movement from inside the abdomen was far harder to confuse with a late meal. By then, abdominal growth and continuing breast changes could support the conclusion. But this was confirmation after months, not the early answer people often imagine. The difference could be enormous. Suspecting pregnancy in the first weeks was not the same as knowing it after the fetus moved. That uncertainty mattered because pregnancy could reshape a woman's work, diet, family plans, social position, and physical risk. The result might be welcomed, feared, or both at once. Yet surviving sources often focus on what healers prescribed instead of what the woman thought while waiting. They also favor societies that left readable texts, especially Egypt, Greece, and Rome. They cannot give one universal answer for every ancient culture. Women outside those written traditions still had bodies, cycles, memories, and experienced helpers, but their specific methods may be invisible to us. Oral knowledge leaves fewer archaeological traces than stone, pottery, or papyrus, even when it guides daily life for centuries. That creates a quiet distortion. The method that happened to be written down can look more common than the knowledge that was spoken and practiced. That missing evidence is important. A lack of surviving writing does not mean a lack of knowledge. It means history preserved the papyrus more easily than the conversation beside a cooking fire. The archive is biased, even when the biology is shared. So, how did ancient women know they were pregnant? Usually they did not receive one dramatic answer. They noticed a missing period, watched for a cluster of bodily changes, compared those changes with earlier experience, and asked people who had seen pregnancy before. Some communities also used recorded tests, including Egypt's surprisingly thoughtful grain experiment. Greek and Roman medicine added long lists of signs, along with several ideas that deserved to remain ancient. Confidence grew over time, and fetal movement could finally turn suspicion into something much closer to certainty. No single clue worked for everyone, and no surviving text gives us the private experience of every woman behind the word ancient. The best answer is not a magic trick, but a sequence of observations becoming harder to ignore. The real ancient pregnancy test was therefore not one object. It was observation, memory, shared experience, and occasionally a bag of barley behaving suspiciously.